Thank you for watching the Housing Oregon YouTube channel. Be sure to join our network and get involved in the work that we are doing. If you can, please like and subscribe. It helps us build this channel, which serves as a platform to communicate with our members. This video is part of our 2025 annual conference. We're looking for folks to be on the conference planning committee. Please email info@housingoregon.org.
For joining today, I'm Jacen Greene. I'm one of the co-founders and the assistant director of the Homelessness Research and Action Collaborative at Portland State University. We go by the unwieldy acronym HRAC. I'll talk a little bit more about our work in a minute. Today, I'm going to very briefly talk about the centers. I'm going to go through some definitions and estimates of homelessness. I'm going to go through the latest numbers that we have available that have been validated. So some of them are a year or two old. I'll explain why we don't have this year's numbers yet. Talk a little bit about causes and conditions, and then I want to make certain I save plenty of time for Q&A. But please feel free to jump in with a question at any point. I much prefer to have a discussion rather than just a presentation. Although I did teach at Portland State for many years, so I am not afraid to call on people if the room falls silent. So we're a research center at Portland State University. We work to reduce homelessness and its impact on individuals, families, and the communities, with an emphasis on communities of color through research and evidence-based best practices. We work with faculty and staff and students from across all of PSU schools and colleges. We are started by 8 different faculty and staff from business, architecture, English, social work, community psychology, urban studies. So from the very beginning, we brought a strong multidisciplinary lens to homelessness research. These are a few of the projects that we've worked on that you might be familiar with. We do the point-in-time counts for the metro region, so Washington, Multnomah, and Clackamas counties. We coordinate all 3 together, and then we release the reports. We did Portland's first ever regional estimate of homelessness and housing insecurity back in 2019. How many of you are familiar with Portland Street Response? Just about everybody, great. So we were part of the group that designed Portland Street Response, and we did a 6-month, 1-year, and 2-year evaluations of the program. We've done a lot of work designing, helping to build, and studying pod shelters, so village-style shelters. We were instrumental in getting the Kenton Women's Village and the Clackamas Veterans Village built. So we've done a lot of work there. We led the nation's very first basic needs survey at a university of both students and employees. So a lot of colleges and universities will survey their students, but they don't actually ask their employees how they're doing in terms of food insecurity, housing insecurity, or homelessness. I think it's a little bit shocking that we were the first, and hopefully other universities will follow suit, because what we found was a lot of basic needs and security among our employees as well as among our students. We've worked at the federal level with the National Academies of Sciences. We've provided guidance for airports and public transit agencies on how to equitably and effectively address homelessness. We do the Oregon statewide homelessness reports for OHCS. And my favorite project is an anthology of comics that was stories of PSU student housing insecurity and homelessness. True stories that our students shared that were illustrated by local comics artists. That was a way to destigmatize the issue and show the different ways that people can be affected by housing insecurity and homelessness. So really, we do a broad range of projects at everything from the city level to the national level. So today I'm going to talk about the most recent homelessness estimates, but I want to give the definitions a bit first. You may all already be familiar with this, but I still like to start every presentation with these. The Department of Housing and Urban Development defines homelessness as lacking a fixed, regular, and adequate nighttime residence. So this is literal homelessness, somebody who is living in a shelter, in a tent, in a car or RV, on the street. It's a very narrow definition. The Department of Education uses the same definition but includes people who are doubled up. So they're sharing housing because of financial necessity rather than choice. You're basically forced into a situation where you're sharing housing. Maybe you're not on the lease, so you can get kicked out at a moment's notice. It's a very precarious situation. And I'm going to go through the ways in which we use these different estimates to collect bits and pieces of information on homelessness overall. We have the federal point-in-time count, which is mandated by the federal government. We have regional and local by-name lists of people experiencing homelessness, which are used basically for service delivery. We have the housing inventory count, which is mandated by the federal government. I'm going to get more into each of these in a minute. The schools do their own count of students. We call it the McKinney-Vento count, it's really a formal name for it. It's also mandated by the government. And then there are some new ways to estimate doubled up homelessness. I call this the homelessness count patchwork quilt, because not every type of count covers everybody. So you can see I have these three sort of main categories of people experiencing homelessness. People who are in shelters, so emergency shelters, people who are unsheltered, people who are doubled up. Point-in-time counts cover everybody in a shelter, and many but not all people who are unsheltered. By-name lists can cover pretty much the same group, but neither of them really count doubled up homelessness well. McKinney-Vento counts from schools will capture school-aged children experiencing all three types of homelessness, but they won't capture children who aren't enrolled in school or adults. And then finally, we have some American Community Survey methods. So we use census data now to estimate doubled up homelessness, and we get sort of an over-under of people experiencing doubled up homelessness. So it's a rough estimate, it's not a count, but it gives us a general picture. And really, once you piece all of them together, you get a much better understanding of what's going on in your community. But neither one of them is totally accurate on its own. And even together, because they use different methods and are conducted at different times, different ways, you get at best a patchwork, a rough idea of what's happening. The point-in-time count, I assume most of you are probably familiar with it, but in case you're not, it is a one-night survey of people who are living unsheltered, along with Homeless Management Information System, or HMIS data, from emergency shelters and some types of transitional housing. So we basically get almost everybody who's in shelters. There are some shelters that don't participate in HMIS, but usually they are asked to fill out paper surveys or use an app. And then for the unsheltered count, people, service workers, government employees, volunteers, outreach workers are going out in the community trying to find people and getting them to actually answer a survey about their experience. So as you can imagine, there are a lot of refusals. A lot of people say, I don't want to answer any questions. And there's a lot of incomplete responses and a lot of people who are missed. It is mandated by the federal government, but what it does is it basically gives us a snapshot of a single night in late January. It's only required in odd numbered years. So some continuums of care across the state and the country don't conduct an unsheltered point-in-time count in even numbered years. So that's something to keep in mind if you're looking at data on even numbered years. What the federal government does is they just roll forward the numbers from the previous year and reuse them. So they're not very accurate. We are working on finalizing the 2025 numbers. I mean, they're literally coming out in like a week or two, but we don't have them 100% verified by the counties yet. So I'm just going to share the 2023 unsheltered numbers and then the 2024 sheltered numbers. So the 2023 point-in-time count found that in total, there were at least 20,000 people who were experiencing homelessness across Oregon on a single night in January. About 2/3 of them were unsheltered. Now we know that these numbers have only gone up in the last 2 years. Last year's point in time count just for sheltered individuals. So there was about 8,840 people who were sheltered on that single night in January across the state. These are overall homelessness rates from 2023, both sheltered and unsheltered homelessness from across the state of Oregon. I think what people sometimes assume is that the highest rates of homelessness are probably in urban areas and cities, but for many, many years they've actually been in rural areas across the state. We see the highest absolute number of people experience homelessness in the cities, but as a rate per 1,000 residents, what you really see is rural Oregon always has the highest rates, year after year after year. So this is a problem that might be less visible in some rural areas, but absolutely affects everybody across the state, urban or rural. And a lot of rural areas, until recently, had very few resources, as I'm sure you all know, for addressing homelessness, for building housing, for providing shelter. I'm going to talk a little bit about the by name lists now. So the by name lists are more or less continuously updated lists of people experiencing sheltered and unsheltered homelessness. Sometimes, but not always, they're run through HMIS systems. They offer a much more accurate picture of both the number of people experiencing homelessness and changes over time. Because you can see, okay, what was the number last month, the month before that? How many people are entering? How many people are exiting? And you can actually track and report that through by name lists in a way that you can't do with point in time count. So while the point in time count is much more of like an administrative number, the by name lists are very useful for service provision and estimating your actual need. This is Multnomah County's by name list. So in June, they recorded almost 16,000 people on their list. But as you can see, there was only about 7,541 who were unsheltered, about 4,800 who were sheltered, and then there was 3,500 who are unknown. So those are people who were entered onto the list, but they didn't have sort of a recent check-in or outreach with them. They know they're not in the shelter. They haven't encountered them sort of through outreach workers. And they remain on the list for a certain number of time, and then they basically get dropped off. Yeah, question?
Just for clarity's sake, is this list, are you talking about HMIS is where the status is at?
Yeah. And so this, like I said, is nice because you can actually see month over month change in homelessness numbers. We released the rough pick count totals back in, I think it was April or May, and it was very, very close to this number. It's very similar. So it's nice to kind of see the numbers more or less matching up, but I think the by name is a better resource for estimating. Yes?
A couple slides ago, you showed the 2023 numbers. Are those the same numbers as, yeah, right there?
Yeah.
Are those the equivalent data to the 2025?
This is a point in time count, so a survey.
Okay.
And this is by name list, so it's updated continuously by outreach workers and by shelter employees.
Thank you.
Yeah, that's a good question. This number is, I think, really interesting. This is Multnomah County by name list inflow. So people who are entering homelessness. And if you look at the numbers, most of them are entering homelessness for the first time. They haven't experienced homelessness before. So a lot of new people are becoming homeless for the first time. And this is the outflow. As you can see, the outflow is not keeping pace with the inflow. But the outflow is not only people exiting into housing, it's also people who they basically lost touch with in the system. So that's important to keep in mind with the outflows. A large chunk of the outflow are people where they're like, well, we don't know where they are. Maybe they found a place to live that wasn't, say, affordable housing, wasn't provided by them, by Multnomah County. Maybe they're living with family or friends, but they just don't know for sure. What they do know is that they're no longer visible in the system. And I think this is one of the things that really makes it tough to demonstrate progress because you can be moving more and more and more and more people into housing. But if the inflow is increasing at a faster rate than you're able to move people into housing, it's still gonna look like you're not doing much, even though you are. Speaking of housing, the housing inventory count is a snapshot of shelter beds and then certain types of housing for people exiting homelessness. So this is collected at the same time as a point in time count. In January 2024, we had 10,408 year-round shelter beds. That was an increase of 31% from the previous year. So Oregon has added a lot of shelter beds recently. This is the growth in shelter beds across the state between January 2023 and January 2024. And I want to note that there are some areas where there's a negative and you see an asterisk. These might not actually be negatives because there were some mistakes from the continuums in terms of where they geocoded the shelter beds, which county they put them in. So some things were moved around, but overall, just about every county in the state added shelter beds, and many of them added a significant number of shelter beds. And this was, I think, predominantly due to the increased legislative funding for shelter beds across the state.
Question on the fund, was that state funding or were those federal resources?
Mostly state funding, because we see sort of slow, steady from federal growth. There were a lot of, there was a lot of federal assistance for things like eviction prevention, rent assistance. I think most of the shelter bed numbers are state assistance.
Thank you.
So the McKinney-Vento Homeless Assistance Act requires schools to report the number of students from kindergarten through 12th grade who are experiencing homelessness. So they do this through teacher and staff observations, registration data from parents, and this includes not only students who are literally homeless, who are living in a shelter or who are unsheltered, but also those who are doubled up. So that could be somebody who's doubled up with friends, not on the lease. It could be somebody who's living in a motel. It's a broader definition of homelessness. But a lot of the research shows that children who are doubled up experience some significantly negative impacts in terms of social emotional well-being, academic performance that's similar to experiencing sheltered or unsheltered homelessness. You'll notice that they don't collect any numbers above 12th grade. Homelessness is a significant problem in college and university students with the increasing cost of housing and the very, very, very slow growth in the amount of assistance you can get, even if you're low income. But there's no comprehensive federal way to capture this information. Nothing's mandated. So universities and colleges do it on sort of an ad hoc basis. So in the 2023-2024 school year, a little over 22,000 students were known to be experiencing homelessness. That's 4% of all students across the entire state. So you'll notice that this is very similar to the total PIT count from 2023 of sheltered and unsheltered homelessness. And this is just students. But when we have a more comprehensive year-long way of assessing homelessness that includes doubled up homelessness, we get a much larger number. This is a much more accurate picture. And again, we don't know what the numbers are for their parents, their siblings who aren't enrolled in school, because those numbers simply aren't captured. Yeah.
Are there other states that have something similar to McKinney-Vento?
It's federal law.
Oh,
so
okay.
yeah,
Okay.
everybody has to do a McKinney-Vento count. The accuracy varies by state because not every state puts a lot of resources or support into counting students who are experiencing homelessness. So sometimes the state-by-state comparisons aren't 100% accurate. You know, a state might look like they have pretty low numbers, but they're just not actually doing a great job of counting students. So these are the student homelessness rates per 1,000 students across Oregon counties in the 2024 school year. Again, like the overall homelessness rates, what we see is that rural counties typically have much higher rates of student homelessness. Yeah.
So are those surveys, are they honest, or you see where they?
Yeah, so it's,
may not want to.
when parents register or update a registration information, there are some questions that ask parents about this. And then teachers and staff are trained to sort of assess indicators, and they'll have conversations with students or students' parents. So they have a number of different ways of trying to get at that information. So I talked a little bit about doubled up homelessness. So that's when you're staying in somebody else's home, typically not on a lease, out of financial necessity or due to a loss of housing, not because you want to live with them. It's not when your mother-in-law moves in, you know, it's different, even though you might not want to live with them. McKinney mental counts only provide a sort of an estimate, you know, like we were just talking about. And teachers and staff are doing their best. Doesn't include doubled up adults. But there's a new method out that looks at American Community Survey data from the Census Bureau. And it is used to estimate doubled up homelessness among an entire population. And it looks very closely at household numbers, how many people are in the household who aren't members of that family, what their income are. So I can get into a lot of detail, even Q&A if you want. But we've used this method across Oregon to put together a rough estimate. And like I said, this is an over-under. So this is sort of our best guess at the number that's in the middle of that. And that's 25,750, roughly. People experiencing doubled up homelessness across Oregon in July 2022. The ACS data doesn't come out very often, so that's why we're using 2022 numbers here. I can almost guarantee that this is probably quite a bit higher in the summer of 2025 based on the other numbers that we're seeing. I think this is really important when we're talking about numbers, is that homelessness disproportionately affects certain groups of people, especially people of color. So, Native American and Indigenous Oregonians experience homelessness at a rate 5.8 times higher than their proportion of the population in 2024. Native American, or Native Hawaiian and Pacific Islander Oregonians experience homelessness at a rate 4.3 times higher than their proportion of the population. And Black Oregonians experience homelessness at a rate 3.12 times higher. These numbers are consistent across the entire country. They're consistent across the country, state to state, between counties, between cities. We see these groups being pushed into homelessness and trapped in homelessness at much higher rates than other groups. We also see higher rates of homelessness for LGBTQ people, for people with disabilities. You know, basically anything where people are going to encounter barriers, discrimination in housing, employment, things like that. It's gonna make it harder for them to stay in housing, harder for them to find housing as they've been pushed into homelessness. So this is from 2024. So this is the complete sheltered count and then partial unsheltered count. Some of the largest counties in Oregon didn't conduct an unsheltered count that year. So it's incomplete, but this is sort of the best we have. And you can see here, again, sort of graphically represented these large disparities that we see in people experiencing homelessness. I think at the Housing Oregon Conference, I don't need to tell you that people typically enter homelessness because they can't afford housing, but I'll repeat it anyway. The federal government found a few years ago in a study that every $100 increase in median rent across the nation is associated with a 9% increase in homelessness. So there's a very, very close correlation between increases in rent and increases in homelessness. Here in the Portland metro area, we only have 22 available and affordable homes for every 100 very low income renter households. And roughly 150,000 households in the region pay more than half of their income for housing and receive no assistance, which means that they're looking at a really severe rate of rent burden. A lot of research has found that when you start paying more than 30% of your income for rent is when you become at much higher risk of homelessness. So that risk just shoots up, and when you get above 50%, it's extremely high. These are some of the latest numbers from the National Alliance to End Homelessness. And you can see here are the national numbers of people experiencing homelessness. This is the rate. You see it going up and up and up. So what we see here in Oregon is very similar to what we're seeing across the country. Over here is the median gross rent for a one-bedroom apartment versus the number of people experiencing homelessness per 10,000. So the rate of homelessness and the cost of rent. You see again, if you map this state by state, you see this association. If you map it across metro region, you see this association. There's been a lot of research that shows this holds true regardless of rates of mental illness, regardless of rates of substance use disorders. When rent risk factor makes it more likely that somebody will end up experiencing homelessness. And that is what I have so far. I wanted to save lots of time for questions, so I can also dig into some of the more nerdy stuff if you want. Yeah, back here.
I might have missed it, but did you have any type of like gender breakdown for total numbers?
I haven't shown that here. In Oregon, it's slightly more men. We see a lot more unsheltered men. We see a lot more women in shelter, a lot more families in shelter than single individuals. I'll leave this up. People can see my email face, my email. Yeah?
Did your research attribute to the increase in homelessness?
Say that one more time?
Your research showed what attributed to the increase in the homelessness?
Well, we know that it's strongly linked to rising rent rates and the lack of available and affordable houses in Oregon. It's hard to find a one-for-one correlation, but all the research we've done on evictions, on homelessness, surveying people, finds that it is that association that is really driving increased rates of homelessness here.
On the scatter plot, where there shows a weak correlation, those states, yeah, do we know what they're doing right? When there's high median rents and low incidence of homelessness?
Yeah, that's a great question. I've looked in the states that are doing a really good job of reducing their homelessness rates, and what they typically have is basically a really robust rapid rehousing or housing first strategy, where they're moving people straight from shelters or straight from unsheltered homelessness into housing with associated services. So the services are, under housing first strategy, are there. They're voluntary. There aren't requirements to enter into the services. The only requirement of a true housing first strategy is sort of assertive case management. So case manager is checking in with somebody regularly saying, what do you need to get back on your feet? What kind of support do you need? What would help you out? And that's something we've seen in places like Houston, strangely enough, where they've done a great job reducing unsheltered homelessness by pursuing a very strong housing first strategy. The problem is that you need to have a lot of housing units available for that. So you're looking at people doing master leasing. You're looking at people converting motels. You're looking at making a lot of housing units of different types available. And that's something that is a real struggle here in Oregon, as I'm sure you all know.
I'm curious what you think would be the highest impact policy change on the state level to address homelessness?
Anything that could produce a lot of housing units that are available for people with very low or no incomes. So I'm sure that's an easy answer.
Hi, Molly Rogers, Washington County. I'm curious, we're seeing some indication of some softening of the rental market and actually some flattening of rents and some higher vacancy rates.
have you ever seen the inverse, where rents have actually gone down and then homelessness rates have gone up?
You know, that would be really interesting. I know there are places like Detroit that have seen rents drop quite a bit. I haven't actually seen research that tracks places where rents have been rapidly dropping to look at homelessness rates in those areas as well. You know, I wonder if there's just sort of a certain threshold where rent is so expensive, even if it levels out, you're not gonna see a big dent. You might see a slight decrease in the inflow. What my guess is that it's probably gonna be out of reach for all the people who are already experiencing homelessness. You can go.
Yeah, kind of on that, in the research, the corollary of what you just said would be that, in the research, looking at, median gross rent for one bedroom apartments, that as that rises, it would stop having, at a certain point, it would stop having as big of an impact on homelessness. That it would have, priced people out. So, do we see in the research that it's a very linear relationship in all the, it looks kind of linear in that, in the other research, is it linear, or is it more of a?
It is very linear, because what you start to see is that you start pricing out people who have very little income. Then you start pricing out people who are on Social Security disability income, which is not enough to pay rent almost anywhere in the country anymore. So you want fixed income start to get priced out. And then you start to price out folks who are working minimum wage full time. Then you start to price out people who are working a little bit higher wages. So unfortunately, it's hard to see an end to it. What you do is you just start hitting higher and higher income households. So you end up with people living in an RV who are working full time, people living in a shelter who are working full time or part time. We see a lot of older adults, huge increase in adults over 55 experiencing homelessness last few years. Because as rent goes up, there's a certain point where renters who are on fixed incomes, that fixed income just doesn't keep up. So that's really, that's pretty upsetting as well. And when you have older adults entering unsheltered homelessness, they often have a lot of health complications, sometimes chronic health conditions, and it becomes much harder to support them in that. They're much more complex needs. So that's an additional challenge that we're seeing.
It's kind of more of a comment. I think it's really hard to, and this is the experience, doing the work on the ground. I can see this. It feels much more like, I know there's good work happening individually with people, but it's harder when you look up kind of to the system. And one of the pieces with this is we've invested, locally here in this region, so much money over the last few years in addressing this, but we're still seeing it rise.
Yeah.
And that's creating a really challenging, a few things that's challenging both for for folks experiencing that, of course, and then the people doing the work. We're seeing morale really being impacted and kind of not seeing a light at the end. And then I think the other part is what the larger community doesn't see that change is happening, because while it might be happening for these 10 people, these 15 other people have entered homelessness. And so it feels a little bit like a catch-22 right now, of we have this good information, but we don't quite have the resources to build all the pieces to do all the things that are needed, because we're not gonna be able to service our way out of this, especially when we talk about the correlation with rising rents and homelessness. So I don't know what to do with that, but I just kind of wanted to name that.
Yeah, I think that's a great point. It's the counties locally have done incredible work with the SHS money they're getting. They've added so many shelter beds. They're doing a great job with rent assistance, which is an incredibly successful preventive strategy. Even while the federal government has consistently underfunded housing vouchers and rent assistance. Only about a quarter of eligible households actually get rent assistance across the country. It's not an entitlement like SNAP, food stamps. But despite all this progress, here's the shelter bed increases, and this is from a year ago, and these numbers have only gone up since then. Despite affordable housing bonds that constructed new housing, people are getting placed into permanent supportive housing programs, you've still got this inflow. It's going up and up and up. So like I said, the outflow can go up and up and up. People are doing a good job. But if the inflow is going up even faster, it's hard for the community to see and understand that something is being done and it is effective, but it's just hard to accelerate at that same scale because there's very little control you have over rent prices.
I also think it's important, like, shelter beds are not housing.
Yeah.
They're
Yes.
included in the point in time count for a reason, they're still unhoused.
Yeah.
So I think it's important to keep naming that, like, yeah, funding's going to that, but it's not solving the problem, it's, yeah. It's
Well, yeah,
not housing.
somebody in shelter is still experiencing homelessness,
Yeah.
even under the most narrow federal definition. These outflow numbers are for people exiting into housing,
Right.
or people who they don't have, contact with for a while. So this wouldn't include shelter beds. But, yeah, assistance will never keeps going up and up and up, it's just hard.
Yeah, so something that I noticed, both since I was providing direct services and now, that I'm managing programs is that a lot of, there's kind of a cycle of people, especially, when we're considering populations like families or individuals who are fleeing domestic violence, for example, who have 2-year rental housing subsidy. Once the 2 years are up, unless there's, like, the coordinated entry is becoming more and more, I think, bureaucratically complex, that in order for people, ironically enough, in order for people who qualify for longer subsidies, they have to have a longer, history of homelessness and ground or documented homelessness or whatever. So how do we mitigate that problem where, yeah, there's a lot of funding for housing subsidies, and especially on rapidly housing, but the cycle doesn't end. I mean, someone, say a mom with 3 kids, how are you gonna pay for a 3-bedroom apartment and working without subsidy? I mean,
Right.
it's impossible.
Yeah.
So how do we bridge that gap?
And that's a great question. It's clear that there are some households that are gonna require probably permanent subsidies to stay housed. And, a housing subsidy is much, much cheaper than a shelter bed. It's cheaper than, permanent supportive housing. Just helping somebody pay their rent, keeping their housing is actually, it's not only obviously ethical, but it's more cost effective for society as a whole. So these rent assistance programs, I think, can be really beneficial, but knowing how long people should get them, knowing which household really need them, that's quite tricky. The VI-SPDAT, which is like, an assessment of somebody's vulnerability that's been used across the country for many years in coordinated entry programs, has shown some pretty problematic outcomes where it was privileging white households over households of color. So it was, again, creating these disproportionate outcomes by race that we see. There's one of the contributing factors. A lot of continuums of care have moved away from the VI-SPDAT, so they're using other tools. Some of them have created their own tools, like Multnomah County and the Balance of State, that are doing a much better job. But again, it's very tricky to figure out how vulnerable is a household, what type of assistance they need for how long, in an environment that is, resource constrained. There's only so much. So it's very much a zero-sum game. It's a great question. And back there?
I'm curious to hear more about the prioritization strategies. And is it related to homelessness being experienced in different ways by different communities? I've heard that being doubled up is more common in some communities of color, and that would give you like a lower score. Is that part of it? And then what are communities doing to adjust and become more equitable?
So it really depends on the tool you're using. The VI-SPDAT is problematic. Even the developers of it said, hey, you really shouldn't be using this to score people, to put them in the coordinated entry. Like, that's not really what it's meant to do. So we're seeing some emerging tools, some new tools being created. Multnomah County, I can't speak to the tool, I haven't done any research on it. We at the Center of looked at the Balance of State continuum of care. They created their own tool, and it doesn't seem to show disparate outcomes by race. So it seems to be fairly fair when you're looking at racial demographics. It seems to be pretty even with households with children versus without. But there's also a question of like should you not be prioritizing anything, or who should you be prioritizing? If somebody has a disability, if somebody has a severe mental illness, you know, how are you scoring that? It becomes like, you know, it's like you have to prioritize people, make certain you reach people who need help the most, but there's also honestly a disturbing element to it, because you're saying, well, this household, this person is somehow more deserving of help than this household or this person. And so you can never really get away from those questions of fairness. I think what the tool is basically quantifying how we as a society are prioritizing one group over another in terms of services received, which is always going to be problematic. But if you're aiming it towards the people who have historically been the most underserved, or who maybe have the most complex needs, at least there I can see more of an argument for that. You didn't know we were going to get into like philosophy and ethics. Got a couple questions back here.
So in terms of that, I wonder if there, and I don't know if other counties in Oregon are doing this, segmentation in terms of who needs what, and using that to inform either a by name list or coordinated entry. So people who have high needs aren't necessarily referred to rapid rehousing. Often that happens because that happens to be the assistance that's available, right? And I get that, you don't wanna turn somebody down if there's some assistance available. At the same time, it's usually not enough for folks.
That's a great question. I mean, I think there is this tension from the COCs I've talked to more about this across the state between how are we matching the right kind of services to households that really need them, to sort of any port in the storm. Like, how do we get this household off the street using whatever tools we have at our disposal? And so, yeah, I don't know if anybody has really figured that out perfectly. Like you said, sometimes rapid rehousing, it was like, we've got a rapid rehousing unit available. It might not be a match for somebody's needs, but at least it gets them somewhere safe and dry.
And then I guess one of the other things I would say about that is, if the rapid rehousing is no longer available for people and they still would benefit from it, then there's not a good process to move them into a long-term subsidy or supportive housing or whatever they may need, because prioritization happens with people who are in shelter and are in shelter, right?
Well, and that's a problem. Let's say somebody's in rapid rehousing for 2 years and then they exit back into homelessness.
Totally.
And then you're just starting that cycle over. But you had another household that maybe didn't get into that rapid rehousing unit, and if they had had a year of support, they could have maybe found a job and found an apartment and moved from the housing. So it's very hard. Yeah. You know, it's really tricky to continuously adjust the services that are available to the population and the needs of the population, because it's just, I'm sure you know, it's such a moving target. And I think that's why things like the by name lists are really helpful. You know, if you have a much better understanding of who's out there, what are their needs, you can more effectively sort of develop services. But of course, you might see a rapid change in one demographic like older adults, and then you're like, well, it's gonna take us a few years to ramp up the kind of supports that older adults need. So you're always playing catch up in a way.
So, as we all know, not only homelessness, but social specific services are politicized currently. One thing that we're struggling with right now, with providers is, you know, navigating this, we have to comply with state orders in order to just exist. But then we have to really change the language and the outreach and what that looks like for the people who are on the streets who might be looking for specific kind of services. How can we find a middle ground, at least locally, where, we're getting county money, we're getting metro money, we're getting state money, but if the agency, say nonprofit as a whole, is operating anything that's too DEI or too woke or whatever, they are putting themselves in harm's way. So what alternative do we have in terms of not necessarily, looking at the numbers based on strictly just identity and race and things like that, but rather, finding ways to kind of stabilize the issue, again, without putting, as a provider, without putting yourself in harm's way when you have a openly hostile, federal government.
That's a real problem. And I'm gonna preface, my answer by saying that in all of our projects, or nearly all of them, we work really hard to engage people with lived experience of homelessness. So in terms of, so my colleagues, right now we have a lived experience advisory committee that helps us design and run research projects. We hire people with lived experience as surveyors to help design surveys. And so, you know, this presentation focused really on, sort of the statewide numbers. It's very quantitative. We do a lot of qualitative work. And when I talk to people, and we talk to people experiencing homelessness, you know, culturally specific services work. It's what they need, especially people who've been marginalized, discriminated against. It what makes them feel safe. It helps them form connections, get on their feet. And so, you know, as somebody who works at a nonpartisan research center at a public university, I will say that culturally specific services are great. It's really unfortunate, as somebody who just looks at the evidence base all the time, that the federal government will reject the evidence base for these types of services. And obviously, you know, fairness is an important issue. I want to make certain everybody has access to services and meet their need. But yeah, I hear people again and again saying culturally specific services really matter, you know, and really help. And so it's, you know, it's heartbreaking to see people not be able to provide those services. And you know, I'm on the board of a nonprofit actually out in Washington County that does youth homelessness work. And we have to be really careful about what we say. And so I think what we're doing is just trying to meet youth where they're at and trying to provide the services they need. But yeah, again, you know, being careful not to label it and trying to show that we're providing services to everybody. You know, and we're just trying to match people's needs. If somebody has a physical disability, we're gonna try to provide, you know, accessible services that meet their need. If somebody's older, we're gonna try and meet that need. So it doesn't mean we're gonna stop doing more culture specific services, but it is a very, very problematic environment right now.
And I think that in this specific insurance business context, a lot of people are falling through the cracks because as we're negotiating, I don't have a background in law, you know, but I have to read contracts and make sure that everything is in compliance because there's a capacity issue. So as we're negotiating with funders, can we amend this language to move this or that in order to like provide services to clients? We're kind of sitting on money that has, you know, executed because our executive leadership is like, well, we're not going to, again, risk the entire agency because we have to comply. And then there's a lack of, again, of capacity or anything sustainable to help families and individuals who are experiencing homelessness in the meantime. So right now, say a contract was supposed to be executed 3 months ago and it's in some sort of legal limbo. We're scrambling out here. It's like, well, we technically have the money in a way, but we can't spend it until it's executed. So what do we do for families who are in the middle of their 2-year rental housing program? So I think that right now there's, when we're looking at the sustainability of the program.
Yeah, the nonprofit on the board of just had to shut down their employment program, which is totally focused on self-sufficiency, you know, getting people back on their feet because they lost all of the funding for it. So it's really hard. Aaron.
2 things. Could you please go to the last slide so I can write down your email?
Yes.
And then secondly, one of the largest growing houselessness rates is 65 plus. I was just wondering if you had any data on, I think, would it be the 2023 count? So when you release the new ones in a week or 2, I would love to just see the comparison in that big bump. I think that's a really often quiet conversation. There's quite a bit of baby boomers retiring each year, each day. It's called like the silver wave, I think, nationwide. So quiet conversation. I'd love
Yeah.
to see some data.
And that's something where hopefully people can begin to see the trend coming and get ahead of it in terms of services a little bit, but it is rapidly increasing.
I'm curious if y'all have done any research on what you have found to be the most effective way of helping people reintegrate? Because working in a tiny house community, we noticed there was a tension between having people in their 20s or young folks who were in a tiny house next to somebody in their 50s or 60s, and realizing that what we were realizing for the folks in their 50s and 60s that they were just needing a place to be able to exist and live, and that many of them had worked for 20 plus years, versus these young folks who maybe did get into substance abuse or had had traumatic experiences, and we were often at a loss of how to help them find a path into their lives. And I'm curious if y'all have done any qualitative research on what is most effective, because it seems like there's sometimes like a cultural absence of knowledge of how do we help people become a part of a society that maybe they have never felt that they've had access to.
Right, that's a great question. I mean, in terms of sort of getting somebody permanently housed and stabilized, there's a lot of research around housing first, which I think is sometimes misunderstood as housing only. But like I said earlier, a true housing first strategy means you get somebody, well, basically you assess their needs as an individual or a household. Most of the time it involves placing somebody in housing without preconditions or requirements. And then you do this sort of very assertive case management or engage with them regularly, and you're offering a variety of services and programs to support them. But you're not just putting them into housing and getting them there. And it's really important to have a range of services and supports. Like you said, an older adult who's been working for decades, maybe they have an injury, so they can't really work much anymore. Versus an younger adult who's recovering from a substance use disorder. They have very different service needs. So you need that sort of portfolio of services available to them, and then you're just working with them to identify what their needs are, and helping them engage with services that might support them. And so it's really, it's more like a customized menu of options, but obviously that's a very large and expensive system to create and sustain over time. So it's hard to stand up a true housing first strategy and scale it across the entire population. But it's been incredibly successful in studies in the US, Canada, and Europe with smaller populations that have very high needs, like co-occurring substance use disorders and severe mental illness, for example.
Could you research advance to go up to the percentage of people homeless have behavioral health challenges?
In the point in time count in the past, I think the 2023 numbers were, it was roughly
680 people of those had two, there was like 680 people who had two disabling experiences, and then later in the data collection, they separated that out, and around the same number of people indicated that they had substance use disorder, and the same number of people indicated they had mental health challenges.
Trying to remember
In 2023.
the percentage. I think it was a little bit over a quarter, but less than a third had either substance use disorder or severe mental illness, but a lot of those were co-occurring.
That same number of people actually happened to be unhoused for 36 months or more as well.
And it also depends. I mean, there are some sort of subgroups where the rate is higher for one or the other, and some where it's lower. So, but that was, if I remember correctly, right about the number there. This year's numbers, I haven't seen the final verified numbers yet. So it'll be interesting to see if that's changed for this year.
It's concerning because I think with the 15 waiver, that kind of stuff, that's sunsetting in 2027, and so that means there's not gonna be a lot of service available.
Yeah. Yeah, and I think it's also important to remember that if somebody has a severe mental illness or substance use disorder, that's not necessarily causal for them experiencing homelessness. If somebody's experiencing unsheltered homelessness, sometimes people start using as a way to cope with trauma, stay awake at night, self-medicate. It can worsen existing mental health issues, so it's really hard to untangle the two.
But if
if it's a disabling experience, does it matter if it came first or second?
It's a great point. We should be concerned about how they're getting support and what type of support they're getting. I know there's a narrative out there, it's like, well, everybody has this, and it's what caused their homelessness, which is not backed up by the evidence. Yes. Over here.
I'm wondering about, the research that you all have done related to, rental barriers as a, factor that can exacerbate rates of homelessness. And then conversely, I can't imagine how this would be structured, but, kind of expectations around, changing rental criteria and like what is legally allowable rental criteria within a county or city, like whether that could possibly mitigate some of the, increased rates of homelessness associated with rental barriers.
I'm sure it would help. I think given that cost seems to be the biggest determining factor, it might help some households access housing that they couldn't otherwise access for sure. I don't know how big or small the impact it would have.
So, the research that y'all have done doesn't include research on rental barriers?
We have looked at rental barriers, but it's hard to predict how much something would affect rates of homelessness.
Mhm.
So would it help? Yes. Reducing rental barriers of any kind are always gonna help. How much will it help? That's really hard to figure out.
Do we know if there's any models out there where people are not only addressing those people that might have deficits, but also like looking into housing those folks who might have positive supportive factors, like those people who are just becoming, like you said, yeah, just things like where we don't want them to slip into homelessness for long periods, because that's part of our coordinated entry is, oh, well, you haven't been homeless long enough, so you're not priority for us. So,
I mean, ideally, rapid rehousing programs would serve people who like just entered homelessness for the first time and just need a sort of a minimal amount of support and get back on their feet.
yeah, but I mean, also like those things, when we're doing those coordinated entry, we're not looking at things of like, do you have a college degree, or do you have things like that could support you being stabilized? We're only looking for the deficits and never the positives. Is there any model out there that is?
A good housing first case management approach will look at somebody's strengths and skills, experiences when they're figuring out what their needs are, but also sort of trying to connect them to resources like okay, you've got this type of work experience, let's connect you to that type of employer.
Yeah.
Or you just need a certificate, let's get you this.
Yeah. But no standardized practice across, like.
I would say that
case manager.
it's probably a best practice for case management and service connection. I don't know to what extent it's like formalized across the region because I haven't looked that much into it. Yeah.
Do you have any data, on what is the length of time someone or family remains homeless? Once the assistance is there, they take the assistance, are we talking about 6 months, 1 year, 2 years? That's one question. And then the next one, I mean, assuming that perhaps there are cases in which, regardless of the assistance, that individual will remain homeless. Is there any data for
Let me really quickly, I'm gonna go back to this, the by name list from Multnomah County. So down here, I've got the link to their data dashboard, which is great. And that goes over average length of time homelessness, the percent of households who are returning to homelessness after they've been housed. So that's a great place to really dig into those numbers. And then your other question was about the number of people, would you restate that one more time, please? Like number of people who are unable to exit homelessness?
Okay, people that the resources are there, simply there is no, I don't know, they're told for, whatever reason, just don't take advantage of the assistance and remain homeless.
Yeah, that's an interesting question. When you talk to folks, often they're not taking advantage of assistance, just in my experience in the interviews we've done. Because, sometimes they've never been contacted. Sometimes they've been offered, but, maybe they've been into housing and then lost housing, into housing, lost housing. There's a certain point at which people lose trust. And they're like, well, why should I bother? And then sometimes people have really bad experiences and they're not being offered the type of services they need. You know, congregate shelters can be really frightening for some people. You know, I've talked to some people, it's like they don't want to live in a congregate shelter because it's scary. But when you say, would you live in a pod village? You say, yes, absolutely. Would you live in a converted hotel room? Absolutely. And we've done studies on the type of shelter preferences that people have. You know, if you don't have sufficient housing, you have to put them in shelter for a while, hopefully while you're getting them into housing. And people really, really strongly prefer converted motels and pod villages. And they really dislike congregate shelters. And honestly, I can't blame them. I mean, if I was in that same situation, I would personally much rather have some private space, right? And what I've found in some of the research that I've led is that when people have a sense of privacy, autonomy, dignity, and safety, they really thrive. And that's something that if you have your own motel room with your own bathroom and a closing door, maybe a hot plate, you can invite people over, or you have your own pod in a pod village, you've got your own personal space. That helps people stabilize, deal with trauma, engage with services, build relationships. So again, you have privacy, autonomy, dignity, and safety and security are really important. It's hard to get those in congregate shelters.
Are these reports available online?
Yes, every single report I mentioned here is available for free on our website. So pdx.edu/homelessness, you can find all of it there. If you have any questions, please feel free to shoot me an email. I'm always happy to talk more about our research, the evidence bases, point people towards other data. You know, our job at a public university is just basically helping everybody stay educated and informed.
Is it appropriate for me to host a workshop that's tomorrow?
Sure.
It's also supported by PSU, and it's a participatory research project that we did that is more focused on the actual, like, lived experience choices and maintaining secure housing, so.
What block is that?
Sisters of
the Road one? Yes.
Yes.
Sisters
And that,
of the Road block?
like I said, I'll do one more plug for our research. This is the members presentation. We do a lot of participatory action research where we work with folks with lived experience, which is super important for this kind of work. You know, you can't get a good sense of what works and what doesn't just from looking at numbers. So I look forward to that workshop as well.
I'm just curious if there are any supportive housing / housing first projects in the Portland area that are operating to fidelity.
That is a great research question. That is something that we've actually thought about seeing if we could get funding to do, because there are some really interesting fidelity scores for housing first programs that are pretty widely accepted. So you could actually go through, and obviously the point wouldn't be to like name and shame. It'd be like, who's offering the fidelity? So, and who isn't, and then do they need some more technical assistance or capacity support to operate to fidelity? And then who are we seeing better outcomes from people operating at fidelity versus those who aren't? Or are people who aren't operating at fidelity maybe making an intentional choice to do something a little bit differently to better serve the population of their housing?
Yeah.
So that's another really interesting research.
So the interest is there, but we haven't done that.
We haven't done it yet.
Okay.
But that's a really interesting research question.
Yeah.
I think we have like a few minutes, right?
Yeah.
Okay, so we can do a couple more
I
questions.
have a question, sir. Is there, kind of back, off the question, just asked, is there any housing first, examples across Oregon that you can pinpoint that have worked?
There are a lot of providers that are following housing first principles, but I haven't, and we haven't dug into their outcomes closely enough to say, this person says they're doing housing first, is doing housing first with fidelity, and is having great outcomes. Does that make sense?
Yeah, I just wondered, because I live in Umatilla County, and, our local provider, they use the housing first model, but, you know, the true housing first, I wonder, is there anyone that's done that and had great success?
Yeah, I just don't know. And there may be lots of providers who are doing this with great success and doing it well. We just haven't had a chance to really dig into that much.
three things. One is more entry than exit, structurally over the last decade. Second is the smart point that somebody made about morale hits with frontline staff, but also with the general public of like, we're doing so much work that it's still getting worse. And then the third thing is the two primary levers of housing production and like getting more money in people's pockets is the way to afford housing. So with all of those things combined, make me wonder, if you were to predict homelessness rates in 5 years, what would be your indicators of choice?
Well, we've got a wild card with federal funding right now, because with all the federal funding cuts, I feel very confident in saying that those are going to drive an increase in homelessness rates in the next several years. Because a lot of these services are very effective at keeping people housed or helping them move out of homelessness and into housing. So we're going to see a jump. You know, we've already seen a big spike in the last few years. I think we're going to see a really big spike in the next few years. Beyond that time frame, it's hard to know. You know, it's really hard to know what the next federal administration will do, what they'll fund, in what way. But I think it's going to be pretty rough for the next couple of years, because that federal funding is used for a lot of programs, and it really does a lot of help, and it's much of it is going away. Any questions?
Yes, and just to piggyback your question, we're going to do here. Do you have any data showing rate of success? Like, are we talking about maybe of the people requesting the assistance, are we talking about 30%, 20%, 50%?
You know, off the top of my head, I think in Multnomah County, and don't quote me on this because this is just based on looking at the website recently, I think they're seeing a more than 80% housing retention rate, which is actually pretty good. It's pretty good. And they have this on their data dashboard. I'm going to keep plugging this data dashboard because they put a lot of work into it, and I love it.
Did you say 80%?
I believe the retention rate is close to 80%.
I'm going to quote you.
Go look at their data dashboard first. And so you can go there, and it actually shows the retention rates, returns to homelessness. I'm really impressed, and I wish every continuum of care in the country did something like this. Lane County does a really good job with their numbers as well on their dashboard. Multnomah County houses.
By retention, you mean a year or more than 2 years?
They, I think, look out up to 2 years. I think is the longest time frame they had up. Yeah.
And that's after assistance ends.
Yeah.
That's considered retention. It has to be for at least a year,
Yeah.
2 years, to be considered retention.
After assistance ends. Yeah. Any last questions?
Does your research give us any indicator how we could improve the morale so that we can face a more likely chance of re-upping the metro housing services there, for instance?
Like
or-
public morale?
Yeah.
I think there is, the counties are doing a really good job with that money. And I think that story is buried in a lot of this data and a lot of these numbers.
Yeah.
And I think the more we can say, look, the counties are doing a really good job, but it's really hard to keep up with the inflow. Hopefully that will help people understand. It's not like the counties aren't doing anything, they're doing great, but they've got their fingers in the dike.
Yeah.
So I guess on that, we should probably end up. But I just want to say thank you all for joining, and thank you all for the work that you all do.
Will we be looking at those slides?
Yeah, they should all be available online for attendees, right? Yes. I mean, how that part, but you can